Good morning, dear colleagues. I hope you can hear me and see me. Please write a plus or that you can hear me and see me. Yeah, all good. Let me introduce myself. My name is Olga Khomenko. I'm a medical affairs manager of Institute Xela. I've been working in aesthetic medicine for 11 years and practicing halal products for 10 years already. So let me share my experience with you. And today we're going to talk about the neck, décolleté and hands area. So let's begin then. 2 words about the Institute Xela. Institute Xela, it is a branch of the big pharmaceutical company Uriapharm, and it was established in 2008, while Uriapharm already had up to 18 years of the experience in the pharmaceutical market. And right now, Institute Xela has more than 10 international representative offices. Also, we have research centers based in Switzerland, Ukraine, in the UK, and more than 500,000 persons, 500,000 doctors are using our products all around the world, more than in 30 countries right now. Institute Xela regularly attends international congresses such as IMCAS, MCA, AMWC, and also the company attends over 60 local congresses and exhibitions annually. Annual studies and observations are published in the worldwide known editions, including Prime Magazine. You can go to the Prime Magazine website and research about the products, about halal products, how the doctor published their observations. So Institute Xela has 3 main branches: injectables, professional and cosmeceuticals. Today we go and talk about the injectable line, particularly Xela Rederm. So let's talk about the body, because the neck, décolleté and hands we can consider at our body. And the recent survey in the UK showed that the women are more dissatisfied with their body than the face. That on average, women feel dissatisfaction with her body every 15 minutes. So it's quite often. And 70% of surveyed British women, they are confident that if they could improve their body, then their lives would have undergone significant changes in a positive way. So let's work not only with the face, but also with the body to improve satisfaction, improve these concerns of women. Factors influencing neck appearance. We can observe that heredity plays a role, extra weight, hormonal disorders, age, thyroid diseases, and also posture. At the neck area, we can see that epidermal and dermal layers are thin. Compared to the face, the skin is very thin in the neck. The skin of the neck takes part of mimic activity due to the platysma muscle activity. When we speak, when we swallowing, so after that we observe that the platysma activity is increased, and we can see that the venous rings appears on the neck area. Also, neck and décolleté quite often as a face exposed to ultraviolet insolation. So we can observe photoaging as well at these areas. So at the neck, we can see that the skin is very dry. The skin of the neck has almost no sebaceous or sweat glands, and that's why it is prone to dryness. There is no particularly lipid layer that performs protective function. So usually skin on the neck is dry. It has low amount of collagen and elastin fibers compared to the face. And as a result, the ability of the skin in this area to take its original shape after deformation is reduced. So when we swallow, turning the head, or we have excessive muscle activities, because platysma muscle, it takes in mimic activity while we are smiling, talking. So this deformation and also the ability of the skin to take original shape is reduced. And I can add also, so at the skin in this area is also undergoes the decreased microcirculation. So there is not enough supply of the oxygen. So basically we are having inflammation here and also very dry skin. At the neck area, we can observe that we have the thickening of the epidermis. So the skin aging at the neck is manifested by the thickening of the epidermis. So even when we touch the skin of the neck, we feel thickening of the epidermis and very dry skin, because we have the reduction of the basic structural proteins such as collagen and elastin fibers. The signs of photoaging in combination with natural process of aging such as hyperfunction of muscle platysma leads to a typical set of manifestation characterized by diffuse dyschromia. So simply to say, while there is a sun exposure to the neck skin, we can observe the spots, dry skin, vertical and horizontal wrinkles. Why neck is one of the hardest areas to treat in aesthetic medicine? Because if we use hyaluronic acid fillers, we face the risk of contouration of the product. So basically we can see the product, the HF filler, cross-link HF filler, as a necklace on the neck. If we use botulotoxins, so botulotoxins do not solve the problem of sagging skin despite platysma muscle is relaxed. So not every patient would be satisfied after botulotoxins. If we use medium depth peeling, it can penetrate deeper than expected because of almost absent sebaceous glands. So there is no protective lipid layer. That's why the peeling we can be concerned about using the medium depth peeling. And what about the beauty machines? The brightest result can be observed on the face area, not at the neck. So how can we treat the problems? Botulotoxin, as I said, but lifting Nefertiti is required, yes, when the muscle of the platysma has a big tonus, so we need to relax it. But blocking excessive expression activity of the muscle, it attracts lymphostasis and worsens the trophic of the muscle. Ablative techniques such as laser, chemical peels reduce the skin flap. We can see the result after that because the skin flap reduced, but we deteriorate the resources of the skin and dehydration of the skin. filler can be used, very soft filler, superficially, but sometimes the filler can be seen as a necklace. And the best solution is redermalization because it improves the skin quality by increasing its regenerative potential. So the problems of the neck area, we can conclude that we can see and observe rings of Venus, turkey neck, pre-jowls, less of turgor and elasticity of the skin, chin maxillary angle changes, and also excessive fat, so such as double chin or big jowls. So there is a portrait of our patient. Problems of the décolleté area quite similar to the neck area. So we can see less of turgor and elasticity at the décolleté area. We can observe linear wrinkles and sometimes stretch marks more closer to the breast area. So why the aging process appeared in the skin? Claudio Francesca proposed the term inflammation. And inflammation, it is quite different from the acute inflammation because it is chronic, mild and asymptomatic inflammation which goes in the skin. Inflammation is characterized by the increased level of pro-inflammatory cytokines. Why it is important to understand? Because we can influence to these pro-inflammatory cytokines. We can reduce their level. So chronic skin inflammation leads to the deterioration of collagen and elastin fibers, glycosylation of dermis proteins, and eventually we can see the premature aging and skin deterioration. How can we influence to the pro-inflammatory mediators? The study was published on the PubMed, where you can find it in the internet just by Googling it. Low molecular weight hyaluronic acid activates pro-inflammatory mediators, so it's just exaggerated inflammation. However, high molecular weight hyaluronic acid activates mediators, reducing inflammatory reaction. So, in this way, using high molecular weight hyaluronic acid, we can reduce inflammation, this chronic, mild and asymptomatic inflammation which goes in the skin. Classical biorevitalization contains low or medium molecular weight hyaluronic acid, up to 1.5 million Dalton. However, Xela Rederm, the product, contains high molecular weight hyaluronic acid, 2.5 million Dalton. In this way, high molecular weight hyaluronic acid is able to reduce inflammation cytokines. It is able to reduce inflammation. The basic difference between medotherapy and biorevitalization. In medotherapy, we are injecting vitamins, peptides, minerals. They work, but not sufficiently. Biorevitalization used hyaluronic acid. However, usually it is low or medium molecular weight hyaluronic acid, which is not able to reduce inflammation in the skin, inflammaging process. Redermalization is quite different. It is a double synergic effect of two acids, high molecular weight hyaluronic acid and succinic acid. Redermalization, it is a proven improvement of skin quality by increasing its regenerative potential. So basically, we are given to the skin two components, high molecular weight hyaluronic acid and succinic acid, and we can increase the regenerative process in the skin using these two components. So what each component does to the skin. High molecular weight hyaluronic acid helps to activate anti-inflammatory mediators, so we reversing the process of inflammation. We restore and maintain water balance in the skin, contribute to the synthesis of basic structural proteins such as collagen and elastin fibers. We provide mechanical support to tissues. So basically, high molecular weight hyaluronic acid works with the main cell of the derma, such as fibroblast. In this way, fibroblast multiplication increases multiplication and production of new fibers of collagen and elastin. And high molecular weight hyaluronic acid, I want to say it again, that it helps to activate anti-inflammatory mediators. On the other hand, succinic acid improves microcirculation and activates lymph efflux. Why it is important? Because aging skin is always very dry because there is not enough microcirculation, but we can influence on it with the use of the succinic acid. Also, succinic acid normalizes cellular energy exchange because it is a metabolite of the Krebs cycle. So succinic acid takes part into the energy exchange in every cell. It has antioxidant properties, prevents damage the cell membrane, and it also has the ability to stimulate the basic structural proteins such as collagen and elastin. So the key advantages of the Xela Rederm that none of the additional components of any other product has such an extensive restorative and stimulative effect on the skin. High molecular weight hyaluronic acid which the Xela Rederm contains, it activates anti-inflammatory mediators. And I want to emphasize that the high molecular weight hyaluronic acid is a product of the big pharmaceutical company Shiseido. And safety, clinically proved ingredients and more than 10 years experience. 30 countries are using Xela Rederm and 500,000 clients annually using Xela Rederm. Intracellular metabolite of Krebs cycle, the succinic acid. So the succinic acid takes part in the Krebs cycle, and also it can restore the energy balance under the hypoxia condition. Let's go and look more closely to it. So the succinic acid has two effects, energotropic action and signal action. It is quite hard to understand. If you have any question, please write them down and I will try to explain in very simple way. So the level of succinic acid increased dramatically under hypoxia conditions. Succinate initiates multiple mechanisms of adaptation to oxygen deficiency. So when we have the hypoxia or ischemia, succinic level increases. And also it has the ability to adaptate the cell to these conditions. So without the succinic acid, the cell would die, but the succinic acid helps the cell to survive. And succinic acid is currently understood to have these two actions, such as energotropic and signal actions. So succinate chemically binds to molecules of energy and facilitating their urgent activation. On the other hand, it has signal action, such as it's accumulated in tissues in the presence of the hypoxia or ischemia. Succinic acid stabilized hypoxia-induced factor. It potentiates expression of over 100 genes of adaptation to hypoxia. Saying in simple words that the succinic acid works as a traffic light and signaling to the erythrocytes to come over to the hypoxic tissue and bring more oxygen. It's signaling to the vessels, to the microvessels, grow here to the hypoxic tissue and help us to survive. If everything is understood, if you have any question, please write down because the topic is quite complicated. So the succinic acid, I want to conclude, it helps to restore energy balance and also it monopolizes the respiratory chain and help the cell to survive under the hypoxic condition. Talking about the skin, aging skin always undergoes chronic mild asymptomatic hypoxia conditions. So by injecting the succinic acid, we restore the energy balance in every cell. And in this way, we are having multiplication of the new fibroblasts, or the new structures, protein structures such as collagen fibers and elastin fibers. Receptor activation of the succinic acid is aimed at restoring energy balance and the efficiency of energy production mechanism. So in this way, the tissue and the cells are able to survive under the hypoxic condition. Also, succinic acid receptors is expressed in various cell types and tissues under physiological conditions. It involved in maintaining of functional activity of the tissue. Especially high levels of expression are noted in the heart, kidney, brain, in a highly energy-dependent tissues. So the system of the succinic acid plus succinic acid receptor is involved in the mechanism of increasing the body's tolerance to the oxygen deficiency. So when we have the hypoxia, succinic level is increased. And also the receptor to the succinic acid was detected on the fibroblast, on the macrophages, at the keratinocytes in the skin, and also in the hair follicles. So in this way, we can confirm, the study confirmed that the succinic acid promoted rapid tissue regeneration. And also the succinic acid and Xela Rederm can be used as a treatment of alopecia. Both components, high molecular weight hyaluronic acid plus succinic acid, influence to the production of the new fibroblast much more higher than the control group in the study, and also if injecting solely products such as succinic acid or hyaluronic acid solely. So we can observe the thickening of the derma by increasing new cells and new collagen and elastin fibers. We observed on morphological study of fibroblast proliferation on human fibroblast culture that the increase of the fibroblast was much more higher than the control group or while injecting solely products such as sodium succinate or hyaluronic acid. So the fibroblast production was increased plus 182%. So two components work in a synergy to produce and develop new fibroblast, the main cell of the derma. But not only fibroblast activity increases, also the concentration of free amino acids increases. Why do we need these amino acids? Because it is a structure, it is like a bricks which helps to restore the collagen fibers, because the collagen fibers, they are made from the free amino acids. So in this way, we are having the thickening of the derma. Moreover, we can observe vascular wall remodeling because succinic acid has the signaling action to the vascularization. So we are having improved the vascular net. And the study showed the intradermal administration of Xela Rederm 2 product, high molecular weight hyaluronic acid and succinic acid, and also the sole product of the succinate. It was observed that this injection was accompanied by increased microvascular density. So we are having more vessels, more microvessels in the skin where the succinic acid is present. So we are having more oxygenation at the level of the hypoxia condition. So in this way, succinic acid, it was proved that the succinic acid can improve microcirculation. And also complete dermal reconstruction. We can observe the thickening of the derma by injecting 2 products, high molecular weight hyaluronic acid and succinic acid in 1 syringe. So the Xela Rederm has the ability to reconstruct, remodel the derma. Complete dermal reconstruction. After the injection of Xela Rederm, we observed that the hyaluronic acid level in the extracellular matrix increased. Also, the state of microcirculation increased production of elastin and collagen fibers. So the general structure of the dermis is changing. The big difference between redermalization and biorevitalization, that the redermalization works with the main cell of the derma, fibroblast, by activation it in 3 times higher than the average low molecular or medium molecular weight hyaluronic acid. So we are having multiplication of the fibroblast. In this way, we are having more structural proteins such as collagen and elastin. So unique formula of Xela Rederm increases fibroblast proliferation, normalize microcirculation because of the activity of succinic acid. It increases the density of vascular network. So we are having more vascularization, more vessels in the hypoxia skin. And also through macrophages, Xela Rederm helps to repair the skin and the natural inhibition of aging. I would say inflammation, so we can reduce the inflammation. Study with ultrasound showed before the injection that the skin had visible impairment of the dermis, weak subepidermal dermal echogenicity. Immediately after the redermalization, we can observe the product on the edge of the epidermis and derma. 2 weeks after the 3rd procedure of redermalization, we can observe relief of the epidermis is recovered, the derma thickened, and acoustic density is increased. So we have the thickened derma, we have restoration of the derma. Moreover, corneometry result showed that the moisture of the skin increased also after the 3rd procedure. With every procedure, we observed the increase of moisture. After the 2nd procedure, it was noticed that the reduced signs of hyperkeratosis, improved skin tightness and hydration. After the 3rd procedure, significantly improved skin tightness and hydration, improved vascular structures of the skin. So conclude the study. we can say that redermalization restores and increases the level of skin hydration and elasticity. It smooths the skin. Why? Because we promote new cells, new fibers of collagen and elastin, so the skin became thicker and smoother, and by increasing the synthesis of the collagen and elastin. Despite the problem that we are having at the neck area, redermalization would work much in more sufficient way than any other methods, such as chemical peel, botulotoxin, or filler correction, because redermalization would improve the skin quality, and the botulotoxin, they work with the underneath structures. Chemical peels, we can have complication with this, also like with the beauty machine. But redermalization will restore the quality of the skin naturally. Hands. At the hands area, we will always observe the dryness. So probably it is the basic complaint of our patient, that the skin of the hands is very dry. So we can observe dull skin color, loss of elasticity, fine wrinkles, pigment spot, hypersensitivity, and also visualization of veins and tendons. And degree of fat involution, when we can observe the veins and tendons. So with 0 degree, everything is okay and hands looks young. With 1st degree, insignificant loss of fat and superficial veins almost invisible. 2nd degree, we have deficiency of the fat, veins and tendons slightly pronounced. With the 3rd degree, we can severity of veins and tendons, and with the 4th degree, visible conturation of veins and tendons. Biological aging is characterized of loss of elasticity of the skin, thinning of all layers of the skin. That's why we can work with the redermalization to improve and restore all levels of the derma, and also work with the epidermis. We can work with the dryness by increasing moisture. And with the fat volume, also we can work with the combined technique using cannula. Photoaging can be observed as the pigment spots, and increased bone pattern, we can visualize the superficial veins and also tendons. The study was conducted also with the Xela Rederm 2.2, and level of moisture. The corneometer results showed that after the 3rd procedure, we can observe the increase of moisture on the hands. Also, elastometry was conducted, and elasticity of the skin of the hands was increased by 20%. To conclude this study, I can say that the skin becomes visibly smoother and more elastic after the redermalization. So what technique we can use? It is a popular technique on the neck area. Sometimes we can use linear retrograde technique while we injecting, but be very superficial in this area because of the veins, not to leave bruises. The patient would be very satisfied and very grateful if there is no downtime period, because papules would be invisible in 2-3 days, but bruises can sustain longer, up to 7 days. On the neck and décolleté area, the preferable product is 1.8 and 2.2%. Papilla or linear technique, it's up to doctor. But while injecting linear, be very superficial as well as papillars. You work with the derma, with the main cell of the derma fibroblast. So be in the derma. If after your injection you do not observe any papillars, it means that you go much more deeper than needs to be. So be more superficial. How to do it? Just the needle needs to be laid down on the skin. In this way, you're injecting exactly into the derma. After the injections, papilla should be sustained. If you do not see the papillas, it means you are too deep. Also, on the neck area and décolleté, different techniques. Papilla or linear. On the first picture, it is shown the linear technique, but you can see that the needle is parallel to the skin. In this way, you are not going too deep. You will be in the derma. So after the procedure, I want to emphasize you have to observe papillas, otherwise you are too deep. And some results after the third procedure of the Xela Rederm. Sometimes even very demandful patient can be very skeptical about the procedure, but after the second procedure they're coming again and again and saying that let's inject more because the skin became more tight, the skin flap reducing because skin restaurates itself. And even venous ring became less visible after the Xela Rederm injection because the skin restaurates. We reduce inflammation. And as you can see on the first photo, it could be seen that the skin is very dry, that the hypokeratosis of the epidermal layer is present. But on this second picture, we can observe that the skin more smoother, more younger, despite the venous ring are still visible, but they are not so deep. I've got the questions here. I can see, can we inject via cannula to deep transverse lines on the neck? Can it affect? Yes, we can observe the effect. Anyway, the product will diffuse. But as from my experience, I would say it is better to work with the derma. With cannula, better to work on the hands because you can restore the volume of the hands. But to reduce the skin flap, you need to work with the needle. Needle also makes some injury to the skin. So we attract macrophages and we attract the new fibroblasts to restore even the injection site. So it is better for reducing the skin flap on the neck to work with the needle. Décolleté area. I want to show you the stretch marks, how they were reduced after the Xela Rederm injections. What the product was used is 2.2%. So in the stretch marks, I would recommend to inject a little bit deeper. So we need to be in the deeper layer to restore the lost these stretch marks. So we need to promote new cells in the atrophic scar. So be precisely at the stretch mark, inject papilla, linear, and deeper. Classical redermalization can be used at the neck, at the hands area, and also with cannula technique, or we can combine using cannula and also classical redermalization. It is quite simple procedure, but I want to emphasize, be very superficial, not to go deeper because lots of veins at this area, so we do not want to have any complications. If the needle, as it shown on the pictures, you can see the needle is quite parallel to the skin. So in this way, you will be in the derma, not underneath. If you do not observe the papilla, it means that you are subdermally. So after every injection, every point, you should observe papilla. So we work with the wrist and also with the fingers. Cannula technique. It is only one injection point, and with the vector technique you can spread the product within the whole wrist. It is quite easy to perform. And always recommend to your patient use SPF filter cream because we do not want to have any problems with the sun. So after the procedure, it is mandatory to apply SPF protection cream. And I want to say that the Xela Rederm won at the Monaco in 2017 the trophy as the best skin enhancer because the quality is confirmed by CE mark. In 30 countries, doctors are using Xela Rederm and it proved its quality and efficacy. It manufactured according to GMC. It is a double synergic effect technology and unique formula, no analogs worldwide. I've got another question. If misinjection to the vein, does it poison or just make hematoma? So basically, we do not have to inject in the veins because we can make a thrombosis anyway. It is even if it is non-cross-linked hyaluronic acid, but it is a gel. So be precise in the derma, do not inject intravascularly. So be safe. How much milliliters we need to inject? So it depends always on the patient, what the patient wants. So at the neck area, we can use 1 milliliter. But if we work with the neck and décolleté, it is better to take 2 milliliters. For the hands, I would recommend 2 milliliters. However, if you combine two techniques, cannula and classical redermalization, it is better to take 2 syringes for 2 milliliters. In this way, you can spread 2 milliliters at the derma and also 2 milliliters subdermally with the cannula. And some results which were shared and published by Dr. Russo, research with Xela Rederm on the décolleté area. We can observe the reduced wrinkles at this area. This is how the Xela Rederm works with the body skin. Another photo was published by the Dr. Russo. And another work. So we can reduce the dip of the wrinkle by restoring the derma. I want to show you a video how to inject. It is a phase, but please be precise and see how to inject, that the needle needs to be parallel to the skin, not to go very deep. It is very important. Otherwise, when you inject and you can hit the vessel, you will sustain bruises, it would be complications. So be precise into the derma and you will achieve the best results. Let me share the video with you.
Hyaluronic science and results. Basic redermalization with Xela Rederm. Instructions for use. Indications. tendency to swelling, deterioration texture and skin relief, wrinkles, hyperpigmentation, acne post-acne, preparation for traumatic procedures. Hyalurol presents innovative solution to solve these problems. Xela Rederm, injectable product based on non-cross-linked high molecular weight hyaluronic acid and succinic acid for achieving redermalization. Double synergic effect technology. Hyaluronic acid helps to activate anti-inflammatory mediators, restores and maintains water balance, contributes to the synthesis of basic structural proteins, provides mechanical support for tissues. Succinic acid helps to normalize microcirculation, contributes to lymphatic drainage, helps to regulate cellular energy exchange, has antioxidant properties, helps to prevent damage of the cell membrane. To solve problems such as tendency to swelling, deterioration, texture and skin relief, wrinkles, hyperpigmentation, acne post-acne, preparation for traumatic procedures. Perform intradermal papular injection. Diameter of papula is 1 to 3 millimeters. The distance between papulas is 5 millimeters. The course is 3 procedures, 2 weeks apart. Step 1. Cleanse. Clean off any makeup with micellar water and soft cotton pads. Step 2. Anesthesia. Apply anesthetic cream all over the face. And wait 15 to 20 minutes. Then cleanse the skin. Use antiseptic. Step 3. Redermalization. Ask the patient to look up and then stretch the skin, using the other hand for stabilization. It is important to emphasize that the injections must be very superficial. The aim is to work with the derma. Start the procedure from the inner corner of the eye. Here, the papulas are administered in a line-by-line pattern. To be sure that the procedure is performed safely on the upper eyelid, injections always should be on the bone, using the other hand to stretch the skin up for easier injection. The injection of the needle should be no deeper than the cut of the needle, approximately 1 to 2 millimeters length. In the middle third of the face, start injections from the center and proceed to the hairline. Diameter of the papula is 1 to 3 millimeters, and the distance between them is 5 millimeters. Step 4. Post-procedure care. After finishing the procedure, apply contactless post-procedure care spray. Protocol. Redermalization with Xela Rederm. Contactless post-procedure care spray. It is important to apply sunscreen after any injections to prevent photo damage. Ultimate eye cream. Intensive eye correction cream. Anti-aging brightening serum in cream for youthful, radiant facial skin.
Dear colleagues, if you have any questions, please write down them. If you do not have questions right now, but you will have in the future, then contact your manager and all your questions will be transferred to me and I can reply as soon as possible. Thank you very much for attending. I hope I clarified all aspects within the succinic and hyaluronic acid with Xela Rederm.